righty. And without further ado, let's get to what brought us all here today. Assessments and evaluating children with a brain injury can be crucial in the role of reducing negative outcomes for individuals living with brain injury and making sure that no child falls through the cracks in terms of the school system and other types of activities that they may engage in. We wanted to ask the question, what do these assessments really look like and how can we look at it from a holistic perspective so that we can better serve children? That's why I'm thankful to have with us Amy Clay to discuss evaluating and assessments for children with brain injury. I'm going to stop sharing here and switch it over while she gets her presentation. I'm going to tell you a little bit about her. So Amy Clay graduated from Marshall University Graduate College with an EDS degree in 2000 and has been a practicing school psychologist in North Carolina since that time. She is a nationally certified school psychologist and is also licensed by the North Carolina Board of Psychology as a licensed psychological associate. Amy completed the additional training and supervision requirements mandated by the Department of Public Instruction, or DPI, to become an approved provider of TBI evaluations in 2015. She joined the NCDPI School-Based Practice Advisory Council for TBI in 2021. In addition to her professional roles related to working with children who have experienced a traumatic brain injury, or TBI, Amy is also a mild traumatic brain injury survivor. A concussion in 2019 required several months of recovery and gave her a renewed dedication to traumatic brain injury work and an additional lens to approach advocacy efforts. Thank you so much, Amy, and I'm so looking forward to learning a little bit more about evaluation and assessments in children. Take it away.
Thank you so much, Lauren. I appreciate the introduction. And I think that this is really good timing for us to be having this conversation because we are at the start of a brand new school year. I don't know if the rest of you are back to work as I am now. So forgive me if my brain's a little slow to catch up with the fact that it's not on summer vacation anymore. And I'm just going to kind of talk you through a few different things related to TBI in the school system. I saw from the Q&A that we do have folks from outside of North Carolina, so just keep in mind my lens is North Carolina, although a lot of these things can be applied no matter where you're practicing your work. So what we're going to talk about today, I've kind of broken this into two different parts. And the first part is what our current definition of a traumatic brain injury looks like in North Carolina. That's changed a little bit and has evolved over the years. So I just want to kind of ground us with an understanding of what it means to have a TBI from an educational lens in the state of North Carolina. And then for the second part, I want to introduce you to the construct model of assessment for potential traumatic brain injury eligibility in North Carolina. And of course, this can be applied no matter where you are. It's just kind of a different way of looking at how you can approach assessments to make sure that we're capturing all of those different things that are so unique about our children who come to us with traumatic brain injuries. As Lauren mentioned, I am a mild TBI survivor. So the joke in my district is always that if I wasn't a really mouthy advocate about TBI before I had a TBI, I really am now. I don't encourage anybody to go out and have one, just so that you have the experience of looking at it through that kind of lens, but it does, it brought to me a different sense of purpose in what I do. So that's just a part of who I am that goes into all of the work that I do. So let me just jump right into acronym soup. If you work anywhere near public education, you know that we absolutely love our acronyms. I do my best when I'm talking to anyone about education or when I'm writing reports or doing any kind of communication to make sure that I'm explaining what those acronyms are. Sometimes I fall back into that acronym speak. So if there's something that you're not sure about, please do not hesitate to ask. You'll hear words like DPI or Department of Public Instruction, EC, exceptional children's services or special education services. Those two things are kind of used interchangeably. IEPs, individualized education programs for students, Section 504 plans. We're going to do just a couple of minutes on RTL as well, which is our return to learn from concussion policy. So again, if you hear me throw some acronyms out there and you're not sure what that is, I know Lauren is working on our chat, but feel free to throw any questions into the Q&A as we go through. So I want to start with looking at how the North Carolina Department of Public Instruction, there are some of those fabulous acronyms that we love, defines a traumatic brain injury for exceptional children's purposes. And let me give you a couple of caveats here. The first of those is that there are 14 potentially disabling categories in the state of North Carolina that could make a child eligible for special education services. TBI just happens to be one of them. They cover everything from autism all the way through our children who may have visual impairments, hearing impairments, learning disabilities, speech language disabilities. So this is just one very small piece of that. And the other thing that I want to make sure that I say is that having an impairment alone does not guarantee you eligibility in the state of North Carolina or anywhere else for that matter for special education services. It's one piece of the puzzle in addition to having been determined as having an impairment, in this case a TBI. You would also have to demonstrate that that TBI is negatively impacting a child's performance and that that child needs specially designed instruction as a result of that. And if you're not familiar with what a Section 504 plan is, 504 plans differ from special education in the simplest terms without the need for the specially designed instruction. For example, I have a lot of students who have like ADHD, for example, who may need things like a quieter place to take a test. They may need extra time on assignments, but they don't really need any special instruction to be able to access those things. So some of those students may be eligible under a Section 504 plan. I've never personally had a child who had a TBI who had a Section 504 plan, but that's certainly within the realm of possibility. So I just wanted to make sure that I put that term out there as well. So looking back at our history in North Carolina, it's hard to believe that we're creeping up on 10 years that the definition was changed that kind of broadened what we in North Carolina look at as the definition for a traumatic brain injury. And the link to the NC policies governing services for children with disabilities is here. This covers everything from what it means to have a TBI to what assessments you need in order to make the determination of a traumatic brain injury. And let me just hit you with all that verbiage on our next slide. Looks pretty simple, right? No, it's really not. It's very complex and there are a lot of different pieces to that. So when I'm working with my school teams, with my social work colleagues, with my exceptional children's personnel in my district, we always make sure that we unpack this definition and go through that. And one of the ways that we do that is we play a little game with them, yes, no, or maybe, for whether or not they think this particular thing is under that definition of a traumatic brain injury in the state of North Carolina. So in the, Lauren, I'm not sure if I can do this in chat. I'm going to try. Actually, I'm just going to put it in the Q&A. Oh, nope, I can't put it in the Q&A.
It might be, yeah. So I think behind the scenes I've enabled chat, but I'm not sure if it will automatically change it to everybody. So
it's only letting me send it to you.
Yeah, so I changed that in the back system, but I just sent it to everybody. And if not, we'll get it to you guys in the follow-up email.
Perfect. So what you're seeing there is really just a very simple Word document that we put together that has these different things that we're going to look at. And we would hand this out to folks in advance of actually doing our presentation and just kind of have them go through and try to figure out if they really do know what a TBI is. And sometimes they were right, and sometimes they were really surprised by some of the answers. So we worked through all of the things that are on that document, and I'm going to go through those with you in the next few slides. And again, this is only for exceptional children's services, according to North Carolina's definition of a TBI at this time. So we're going to start with whether or not a traumatic brain injury can occur in a single event, or it can result from a series of multiple events. And the answer to that, if you're playing along at home, is that yes, according to the definition, it can be a single event or it can be a series of events. Where we're seeing that most often is with multiple concussions. I actually had a young lady at the end of last school year who over the course of a month sustained 3. How on earth she was allowed to continue to engage in activities that allowed that to happen, I don't know, but she's one that we're definitely keeping an eye on, that we may need to put some additional supports in place moving into the current school year. A TBI can occur with or without a loss of consciousness at the time of injury. A lot of folks are surprised by the fact that the answer to that is yes. I think, and you'll hear me say this several times today, there's a real difference between what medical providers say is a TBI and what those of us who live in public education define as a TBI. So that's an area that we're still working with our medical colleagues on, just making sure that we all have some shared vocabulary there. Some causes for potential traumatic brain injuries can include open head injuries. And when we're talking about open head injuries, we're looking at things like motor vehicle accidents, assaults could even be included here. So of course the answer is yes, open head injuries. That was actually on the old definition and carried through as well. A place where we've actually been able to do some expansion, however, is with closed head injuries. Concussions obviously would fall under this area. And another area, or another medical condition that falls under a closed head injury that I've seen 2 of in the time that I've been doing TBI evaluations is shaken baby syndrome. We all know that the effects of those can be completely devastating. So that is something that under North Carolina's definitions could actually be considered to be a traumatic brain injury. And I agree with that wholeheartedly. The next one that we have is toxic substances. When we're thinking about toxic substances, we are looking at things like metals, heavy metals, lead, mercury. This could also include something like carbon monoxide poisoning. So yes, those things definitely could be included in the current definition of TBI in North Carolina. The next one that we have is learning disabilities. And the answer for that one actually is no, that one is specifically not included in the definition. And here's the explanation as to why. With a learning disability, we typically look at those as a developmental difference in the brain of a child, whereas with a TBI, an event actually had to occur. So in other words, you had one level of functioning, an event occurred, and now you have this other level of functioning. So something had to have happened to have made a difference in that level of functioning. With a learning disability, that's not necessarily the case. So just kind of keep that buzzword of an event in your mind as we continue to move forward. Cerebrovascular accidents. These could include things like stroke or aneurysm. And definitely, I see way too many of these kinds of things with the students that I've encountered over the years. The next one that we have is electric shock. Electric shock is not one that folks tend to see a whole lot or even hear a whole lot about. This can include things like lightning strikes, even children who get a little too up close and personal with an electrical outlet in their homes. And the answer to that is yes, that actually could potentially be included under the definition of TBI in the state of North Carolina. The next one that, as we're breaking down our definition that we've included here, is anoxia. If you're not familiar with anoxia, there are 2 different words that kind of sound alike and they're pretty similar in meaning. anoxia and hypoxia. Anoxia means that there's a complete disruption of oxygen getting to the brain and the other parts of the body, whereas hypoxia means it's a reduced flow of oxygen to the brain and other parts of the body. Anoxia or hypoxia, either one, could be contributing factors to a traumatic brain injury, because we know that even though the body can manage a very brief disruption of oxygenated blood traveling throughout the body, after some point in time, cell death does occur, and that can lead to damaged tissue in the brain that unfortunately typically does not recover completely. So those are words that if you see them, just be aware that that does potentially fall under our category. Anoxia could also include things like near drowning experiences, suffocation, choking. Those are all things that could potentially fall under that disruption of oxygen to the brain. Medical or surgical treatments. This one's kind of interesting because even though medical providers are doing things to help address another significant health issue, what they're doing may actually cause what we would consider to be a traumatic brain injury in the educational realm. And those could be things like surgery itself, radiation, chemotherapy. Those are all things that could potentially impact the development of a child's brain pretty significantly. Seizure disorders. Seizure disorders is always an interesting one, and I probably get more questions about this one than anything else in our definition at this time. So the answer to that one is maybe. Maybe they're included, maybe they're not. I truly think that this has to be a case-by-case situation. And I've grown to look at seizure disorders as kind of a spectrum, where we have those children who have seizure disorders that are well managed, or maybe they have just those smaller absentious seizures that really aren't impacting anything significantly. And again, everything is a case-by-case basis. But on the other end of that spectrum, you have children who have what medical providers would call intractable epilepsy. In other words, their seizures are not well controlled at all. So in that case, that's potentially a situation where those ongoing seizures, or maybe the results of those seizures, could be impacting what's happening with the child. So an example that I always like to share when I'm talking about seizures with a group is I had a young lady several years ago who had intractable epilepsy, had lots of seizures, and we called them big seizures because she hit the ground when her seizures occurred. She actually had a vagal nerve stimulator put in, which if you're not familiar with, she was supposed to control those impulses that ran up the vagal nerve to the brain to try to disrupt seizure activity when she felt them coming on, because she did get sometimes a little bit of warning, so they were trying to head those things off. What happened, or what we saw happen over the course of a few months as things got progressively more difficult for her, were that she was having a lot of falls as a result of her seizure activity. She had one pretty significant concussion from falling out of bed while she was having a seizure. Shortly after that, her parents put bed rails on her bed to prevent that from ever happening again. She had one in a classroom at school where she fell out of her desk and chair and hit her head on the desk that was right beside of hers. And the most significant one was she actually had a seizure that came on with no warning while she was walking down the steps getting off a school bus. So those are the kinds of situations where we did end up going TBI based on all of the medical information, the progressive things that we were seeing with this child. We had concussions on top of a seizure disorder. So my answer to seizure disorders is always, it depends, because you really have to take a look at exactly what's happening with that student. If at all possible, collaborate with the healthcare provider and have some conversation with them about what this looks like for this child and what the potential long-term effects are. So no, we don't want to automatically include every child with a seizure disorder under the category of TBI. That's not appropriate. but there are those cases that are out there. So just kind of keep that one in mind, that that's a possibility as we're moving forward and looking at the definition. Infections. This is one that people tend not to think a whole lot about either, but things like bacterial meningitis, for example, viral encephalitis, which happens. And if you ever watch the news, you know that every summer, the news folks tend to get really excited when they have at least one story on what they call the brain-eating amoeba. That's actually a parasitic infection, and it absolutely can impact the brain. So those are things that we don't tend to think about a whole lot, but yes, infections can absolutely be an underlying cause for a traumatic brain injury in the state of North Carolina. Tumors. When people think about tumors, they would probably automatically go to yes, but I want to expand on tumors just a little bit. Tumors can be the source of the injury. In other words, they can be, maybe their growth has inhibited some kind of functioning in certain parts of the brain. So the tumor itself can be the source of the issue, but the treatment of the tumor can also be an issue. So just because a parent says, oh, yes, they had a tumor, but it was taken care of and it's no big deal anymore. My question is always, how was it taken care of? Was there radiation? Was there chemotherapy? Was there surgery? Like, what happened after the tumor was diagnosed? It's great that it's been dealt with, but what are the potential effects or outcomes of the treatment of the tumor? So I always try to make sure when I am thinking tumors, I also think treatment and intervention as well. Another area that we want to take a look at is kidney or heart failure. And again, this is one that people tend to not think about a whole lot. But the answer to that is definitely yes, because if we have heart failure, we have a disruption of blood flow, obviously. An example of this is that I had a young man, probably about 3 years ago now, who had heart failure and was placed on, if you're not familiar with this term, it's one of those fabulous acronyms. This one belongs to medicine, not education, though. ECMO, E-C-M-O, which basically means that, well, it stands for extracorporeal membrane oxygenation. So his blood went outside of his body to get oxygenated and then went back into his body again to keep cells alive. That's the very simplistic definition, not a doctor. So he eventually got a heart transplant, but because there were so many periods of his heart stoppage and the ECMO on top of that, that we did end up having some conversation about a potential TBI there just because of the amount of time that his brain went without oxygen. And we did see some minor issues. It probably definitely wasn't one of the most severe cases of TBI that I've ever dealt with, but it's something that we tend to not think about. So we want to make sure that we're keeping those kinds of things in mind as well. And this last one is another one that we tend to not think a whole lot about, and that's metabolic disorders. Nutritional deficiencies, while they're not very common in our part of the world these days, there are things out there like iodine deficiencies, which research tells us can actually cause IQ scores to drop by about 15 points. That's pretty significant in my book. Severe diabetes, typically that's going to be something that could be addressed under the category of other health impairment. But if it's really not well controlled, that's something that you kind of want to keep in mind for students. All students with diabetes are not students who have traumatic brain injuries by any stretch of the imagination, but it does fall within this category and it is something to think about. So that's part of the reason that we like to put this information, at least in our district, out to the folks who are talking with parents and doing EC paperwork, because we want to kind of plant those seeds that this is something that we kind of need to keep in the back of our minds that could be a possibility for this child. So the next one that we have is congenital or degenerative brain injuries. Congenital meaning it was present at birth, and this can include things like chromosomal differences, and progressive meaning it's getting, or degenerative meaning it's progressive and getting worse over time. this is a no under the current definition. Those of us who do this work a lot are not always super excited about this. I actually had a young man like 8 years ago who had a very rare and unique white matter disorder that was degenerative. Nobody could figure out exactly why it started. It actually started while he was in high school, and over the course of